My name is Tim Oakes. I'm the Faculty Director of the Center for Asian Studies. But I want to start with just a comment that there's no good time for a disease epidemic to burst onto the international scene. But the novel coronavirus that emerged in Wuhan last December came at a particularly bad time from the perspective of U.S.-China relations and from the perspective of the broader impacts of the epidemic. The virus emerged on the heels of a protracted trade war initiated against China by the Trump administration, and on the heels of a general rise in negative sentiment towards China in this country, fueled by rising anti-immigrant rhetoric more broadly, and more specifically, by fear of Chinese technology firms like Huawei and their expansion into global broadband and 5G cellular networks, along with suspicion that Chinese scholars and students studying and working in the United States are working as agents of the Chinese state. As was articulated to us during a visit last year by Robert Daly of the Wilson Center's Kissinger Institute, quote, "The days of constructive engagement with China are over," unquote. That is something that I refuse to accept. The ways that the coronavirus has spurred to an even higher level incidents of blatant racism and discrimination against Chinese people in the US and elsewhere in the world, as well as Asian Americans or anyone with some sort of ties to China, provides ample evidence, I think, of why we cannot turn our backs on engagement with China. I would add that the internment of Uyghurs in Xinjiang, the event that Sarah just announced, is also reason for engagement with China. We can't afford to do otherwise when the abuse of human rights is at stake. Because once we start isolating China, the othering begins in earnest, as it already has with this epidemic. Conspiracy theories have been circulating in earnest. There are dueling versions on the right and the left, dealing with the virus as a bioweapon released by all sorts of different culprits, depending on which flavor of conspiracy theory you subscribe to. Conspiracy theories thrive in an environment in which groups are isolated from each other and in which normal channels of communication and exchange are shut down. Like the epidemic itself, the world's problems are too big for any one country to solve on its own. Engagement starts from communication, from building trust, from acceptance of difference, and from empathy. So we hope that with this teach-in we can provide some perspectives and some resources through which meaningful engagement, as opposed to irrational fear and discrimination, discriminatory othering, that is, can begin. So what we're going to do is we're going to hear from our three panelists. I want to also, they're going to show some slides. Some of the slides will have some links. I've also got some slides with some links to various resources, readings, information, resources. All those links that you see here we will have available, we will post on the CAS webpage following the event. So if you look for that on the main page of the CAS Center for Asian Studies, you'll see a post that has a link that can take you to slides that will have the links that we show here. So if you're busy to copy down URLs, don't worry. You can find them after the event on the website. Okay, I'm going to introduce our three panelists, and then I'm going to hand it over to them to tell you what they have to say. So we're going to start with Dr. Molly Lam. Molly obtained her PhD in epidemiology from the University of Colorado. Upon graduation, she was an epidemic intelligence service officer with the CDC, during which time she responded to multiple outbreaks and worked at federal headquarters during the H1N1 flu pandemic. She then returned to Colorado and is now an assistant professor of epidemiology at the Colorado School of Public Health and a senior investigator at the Center for Global Health. She teaches and conducts epidemiologic research around the world with a focus on infectious diseases. Following her will be Xiaoling Chen. Xiaoling Chen is a PhD student in the Department of Geography here at the University of Colorado Boulder. She has an MA in medical anthropology from the University of Colorado Denver and a recent publication in the journal Human Organization on chronic poverty among Colorado's refugee populations. She's currently studying China's healthcare reforms, and in particular how people access healthcare in rural and in more marginal parts of China. And finally, beaming in remotely from Shanghai, we have Travis Klingberg. Travis received his PhD here in geography at the University of Colorado at Boulder. He has held postdoctoral positions at the Rachel Carson Center at Ludwig-Maximilian University in Munich and at NYU Shanghai, where he is currently joining us from. His current, or perhaps I should say, current and future research focuses on waste and wellness in post-industrial China. That is how industrial centers in China's interior transform themselves into centers for health and wellness. So with that, I'm going to hand it over to Molly Lamb, and then we will go from there.
So I was a disease detective with the CDC for 2 years, and then I came here to be an assistant professor. And so I work in the Center for Global Health, and we are currently actually scrambling to write grants to get funding to do coronavirus research in parts of the world that have not yet been affected, but we suspect it's coming. The latest word from the CDC that I just got before we came here was that there is a moderate concern that this thing's going to blow up. So let me give you a little bit of background. Before I do that, I need to give you a disclaimer. Everything that I show you here, this is drawn from published news reports, peer-reviewed journal articles, and stuff that's been presented at WHO meetings recently. This is a rapidly evolving epidemic. Information presented today may be obsolete tomorrow. Actually, one of my slides is already obsolete, because I made it last night. Also, I am not a medical doctor. I cannot give medical advice. Please don't ask me for medical advice, and don't take what I say and put it on Twitter and pass it off as medical advice. Everything I have is recommendations straight from the CDC and the WHO, and I advise you all to use those sources if you're looking for medical advice. Okay, so I'll give you a brief chronology here. This is, I think one of our other panelists is going to do so as well, but these are the things that stand out as an epidemiologist. Back in December, there was a few reports of a new lung disease. They were squashed initially, but we have now found out more details about them. We had 27 cases by the end of the calendar year. It was then identified rapidly by Chinese researchers as a novel coronavirus. And I want to commend the entire Chinese scientific community right now for how fast they are working on everything related to this virus. Then we discovered it was fatal, and then we started having cases outside of China. By the end of January, the WHO, which is the World Health Organization, had declared a public health emergency of international concern. That's what PHEIC means. This is not yet a pandemic. We don't use that word lightly, but it's on its way. So, but not yet. So we have also now had deaths outside of China, and the most recent debacle related to this is the cruise ship issue, where we've had cruise ships with cases on them. They then quarantine the cruise ships, which is about the worst public health decision you could ever make, because now they have hundreds and hundreds of cases on those cruise ships from passengers that probably would have been fine if they had let them off and quarantined them in a different manner. So, this is a website that we keep an eye on daily in the scientific world. Here's the link to it down here. And this is a great tool put out by Johns Hopkins University, and they update this constantly. Like I said, this was put up. This is the screenshot from last night. This is already obsolete. And so what we're looking at, 75,000 cases that we know about, 2,000 deaths that we know about. And we have over here on the far side, this is one of the things that us epidemiologists get all geeky about. This is called the epidemic curve. And so you can see the orange dots show the cases in mainland China. The yellow dots show the cases in other locations. They plot those separately because they're concerned about containment, and they're concerned about how different governments react and deal with outbreak situations. And we'll talk a lot about how China is reacting to it today, I'm sure. And then they plot the recoveries as well. And so you can see, like, it's going up steadily. What we look for when we look at these is when do they start to drop off. We're not seeing any drop off yet. We saw a big jump because there was a change in the reporting status, or how they reported things. But that's how we track them every day. And then they run Over here on this side, they run just the running tally of number of cases by country in order of greatest to least. The US does not actually have 29 cases, they have 15. For some reason, yesterday they thought there were 14 cases in Nebraska. There are not. But it's just a demonstration of how misinformation can very easily get propagated, even on very reliable news sources. So, I'm going to teach you a couple basic epi terms. The first one is incubation period. This is how long the virus can be in your system before it shows symptoms. So they're looking at 2 to 14 days. This is standard for an infectious disease. If you think of any flu-like illness, it's going to be about this, so there's nothing surprising there. The serial interval is the time between the onset of symptoms in one person and then the onset of symptoms in the person they infected, okay? And that has been about 7 days is what we're looking at. Basic reproductive number, this is one of our favorite numbers in epidemiology. Have you ever seen the movie Contagion? Has anyone here seen that movie? Okay, you know the scene where Kate Winslet gets upset and she stomps up to the whiteboard and starts scribbling on it and is like, this is R0, and this is how fast this is going to spread, and this is how many. She was doing a reproductive number there. Okay, so you can all go back and watch that scene now, understand what she's saying. I will give you some details on how that is calculated. It's not a difficult calculation, but I'll show you that in the following slides. And then the case fatality rate is something that we're all very concerned about because you can have a disease that spreads like wildfire, but it doesn't kill anybody. We're not as concerned about it. You can have something that doesn't spread very fast, but if it has a high fatality rate, a case fatality rate, then you're really concerned. So, well, I'll show you a couple case fatality rates for other diseases that you know about so you can put this one into perspective. But this case fatality rate currently is about 2.3%. And the fatalities we have been seeing so far, the majority have been in older people and in people with comorbid conditions, which means they have some sort of chronic illness that's making their body weaker to start with. Okay. So the basic reproductive number we call R0 is how many cases does one person infect. So you get coronavirus, you start sneezing and touching surfaces and whatnot, and you're going to infect other people. How many people on average do you infect? So this person, he's sneezing, he infects one person. Oops, not what I want to do. That person goes, remember now they're infectious, because they got the disease, they go infect more people. They all go infect more people, right? They infect more people, and it keeps going. So the average, when we say the R0, the average number of people that a single case infects is between 2 and 3. To contain a disease, you need that to be below 1. Okay? How do you get that? Any ideas?
Masks?
Masks. We'll talk about masks later. Vaccines help, right? If you're not susceptible, you can't get the disease. Vaccines lower the R0 dramatically. Containment, quarantine helps, right? But in the current environment that we have, our R0 is somewhere between 2 and 3. For reference, can you guys read it? Oh, good. It's nice. This is a huge screen. Measles is one of the most infectious diseases we have. You can all remember that we actually do have a measles issue going on in the world right now, too. The R0 is between 12 and 18. So between every single person with measles will infect 12 to 18 other people if they are an unvaccinated population. This is why we have measles exploding right now. Some of the other coronaviruses that you know about, like SARS is actually coronavirus. Remember SARS coming out of China in 2003? Has about the same R0 that we have here with COVID-19, which is what we call it now. Influenza, the pandemic strain, the one that killed millions of people around the world, also has an R0 of about 2 to 3. Ebola, which we're all terrified of because it has a really high case fatality rate, which means that almost everybody that gets it dies, has an R0 around the same range. So speaking of case fatality rates, let's take a look at coronaviruses. Other ones, SARS, which was really bad. It was really terrifying. It was actually one of the 5 WHO declared international emergencies within recent years. They had 10% fatality or case fatality rate. They only had 774 deaths total from SARS. How many deaths have we had so far from coronavirus? Over 2,000, right. So we're already way beyond SARS here. MERS, which is another coronavirus that was mainly in the Middle East, and spread by camels. I don't know if you remember this one. Had a much higher case fatality rate of 36%. So for coronaviruses, we're not doing too bad here if we can believe the numbers that we're getting reported. We're looking at a case fatality rate of 2 to 3%. For reference, when you think about flu, like I said, the pandemic flu of 1918 had a case fatality rate similar to what we're seeing with coronavirus. So if we get the kind of spread with coronavirus that we had with the 1918 flu, you can predict what's going to happen with the fatalities. Seasonal flu is much, 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 much less. We are below 0.1% on normal flu viruses. That being said, last year, 35,000 US citizens died of flu. So, we're still talking death here. All right, transmission. So you're wondering, how do I get this and how do I not get this, right? This originally is believed to have come from bats to humans. There's a lot of finger pointing at the Chinese wet markets right now. They believe there could be an intermediate animal host as well. There is currently no vaccine. They are working on this really, really fast. They're actually, the last I heard, they're taking the existing SARS vaccines and trying to modulate them to work for this. Okay, they think this might be a seasonal vaccine. It thrives in cold, dry conditions, which means that as spring comes, this might actually fade out on its own. Be nice. I don't know if that's wishful thinking or if that's based on massive amounts of science, but that is what I've been hearing in the scientific literature so far. Okay, it can spread through droplets, through airborne, so sneezing, fecal oral, which you can all figure out what that means, and surfaces, which means if somebody touches a surface and they have it on their fingers, somebody else touches that surface, up to 9 days later, they can pick it up. Okay? These are all coming from published reports. You can spread the illness before you're symptomatic, which is the biggest problem, which is why they are no longer doing airport screenings. And 80% of cases are mild or asymptomatic. Just because you have a mild case and you spread to somebody else, that person may have a severe case. Okay? Children tend to have very mild symptoms. They actually tend to get diarrhea, is what it looks like. But they shed the virus for a long time. So they're asymptomatic or mildly symptomatic. You don't even realize they have it, but they can spread it to everyone else in the household or their school or whatever. Okay, should I wear a mask? Do y'all have masks? Okay, this is what's coming out of WHO. If you are healthy, you only need to wear a mask if you're taking care of a person who is a case. Okay? Wear a mask if you yourself are sick so that your coughs don't get out to the world. They are most effective when you actually wash your hands a lot. This is the most important public health thing I can tell you right now. Wash your hands. And if you actually do wear a mask, know how to use it, know how to put it on and take it off. That's a really good way to infect yourself, is to be touching your mask wrong, and how to get rid of it properly. And this is what you actually can do, because this is everybody's question. Avoid close contact with sick people, don't touch your face, stay home if you're sick, cover your sneezes, disinfect things, and wash your hands. That's all there is to it. All right, so I don't know if you guys have these in your other slides, but I wanted to show them a little bit. These are some of the banners that are being displayed in China right now. These are huge banners, by the way. And these are the interpretation of what they say on them. I'm assuming. Somebody else can correct me if they're wrong. A surgical mask or breathing tube is your call. If you hang out in public today, grass will grow on your grave next year. They're serious here, guys. They're talking about, they're very strongly encouraging citizens to be responsible. And this is one of my favorite ones. See you in hell tomorrow. So, and on that note, I will hand over the microphone.
Hello everyone. So as a Chinese international student in here in the United States, there's not much I can do to kind of keep informed of the situation in China. So what I do is I get online to look into the social media every day. So those are some of the information that I found since the end of December 2019. Because I'm very curious about what's happening in China, and that also can inform my own research as well. So social media, that's WeChat, that's the only way that I can know a lot about China. My Weibo, my other social medias are blocked right now because I cannot use my phone a lot. So it's very difficult. So WeChat has over 1 billion monthly active users right now and 8 million official accounts. And then I will show you how these things are very, very useful during this Cholera outbreak. So I will talk about how do public and health professionals respond in China and how do government react. First, I would like to show you a timeline here that is very, very critical. So we realized there's a first case on December 1st. And then in the middle, you can see this red line here between the end of December and until January 17th. That's when Wuhan didn't release a lot of information because there are two conferences coming up in Wuhan between January 6th and January 10th. There are two sessions in Wuhan, and January 11th and January 17th, there's Hubei province, two sessions as well. And then they try to control the information, and it's also during these 2 weeks when the Chinese are responding very actively in WeChat through a lot of interactions with their families, with some activists, and with some official accounts as well. And I would like to show you some of the things that emerge from these discussions and interactions. First, in the first 2 weeks, in the 2 weeks before the Chinese New Year, there are lots of public engagement in self-help, disseminating information as well as dismissing rumors. So as you can see, these different official accounts, those are some individual activists and some informal communities. For example, this one, I will talk about this one a lot. It has 3.2 million physicians worldwide, and it involves a lot of physicians from hospitals in China. So they get to receive a lot of information from different health facilities, and then I will provide more information in that. So with a lot of information provided by these official accounts, the public are able to disseminate this information. But it's always very difficult to keep track of them because they will get deleted very fast. And I try to document them as I read aloud this information. Sometimes when I become very busy, like campus work and stuff, 2 days, they're gone already and you cannot read them anymore. So those are the information, the situation on WeChat. And same thing happened also in China as well, where a lot of people right now in China communicate with their families, their friends through WeChat. And that also affects how this information can be disseminated as well. And the second theme is, we can see a lot of the Chinese at home and also abroad as well donate a lot of these health supplies to health facilities in China. As you can see, this is one from Lin Xiangyuan, the official account I just showed. It actually updates, sorry I can't translate them because there's so many Chinese in there. They actually keep updating, for example, that one says 44 hospitals in Wuhan are in need of health supplies. So they keep updating those information so that if anybody have any information about these supplies, they can contact those hospitals. And then in the middle, you can see those some of the Chinese students grew in the U.S. or in other countries, for example, Canada there. So they try to get people to donate money to them, and they buy supply, and they transport them back to China. But now we know that the transporting routes are blocked by the Chinese government as well. But some of them still have some personal channels that they can use to transport these supplies. And then the last one is some individuals will donate some, for example, like hundreds of masks to individual institutes in order to show their solidarity as well. And these are a screenshot by a physician there. And this is a website, Chinese are very creative in a lot of ways too. Because a lot of WeChat informations are censored by the Chinese government and they're deleted very quickly. So they start, like this person called Shimo, start to have this website. It's a little bit similar to Google Doc, where you can document all the information in like Google Doc, Google itself, something like that. And you can see that there's, for example, if you go into that, you can see a list of this information of the patient in need. So some of those patients are patients who are infected with novel coronavirus. Some of those patients have pre-existing conditions like heart diseases or AIDS, something like that, and they don't have access to health services anymore because of the outbreak. And so they need help there, and they will, if you look at this, these are the information of the patient, and usually they will provide their phone number, their age, and what are the issues they have, and those are the details. Like, they will update with some dates, like this one is February 7, what happened to this patient, and then there's some other updates as well. And this has some, like, what do they need based on this information. And for example, this one says, in February 17th, this mother get into the hospital and receive treatment already. So there's some gaps in there in terms of the days, and we'll see how desperate people are if you read through this. I'm sorry that they're all in Chinese, so I cannot translate them. It takes some time to do that. And that has like hundreds of patients in there in that Excel document. At the same time, in this same website, if you look into that, there's another link that you can look at that. Excuse me. So they also help to supervise the bureaucrats and authorities. Since the end of January, the Wuhan authorities start to block all the supplies, like mail to Wuhan. And they actually put them all together and dispersed by Red Cross and also newly found response reserve command. And they also put out this information like how many masks are dispersed on which day to which institute. So there's a group of volunteers who try to document all this information in there in order to help supervise them. There are lots of gaps right now found in here because, like, for example, they say 80% of the supplies are dispersed by the newly formed Response Reserve Command, and they didn't say where are all these supplies go, right? And then we'll see what happened, like what are the critiques of this in some later slides. And by February 17th, more than 32,000 health professionals from across the country volunteered to aid Hubei. And there's a very, very interesting thing happening here. So this is from an article published by Ding Xiangyuan, again, the official account, showing that those physicians volunteer to participate in the aid of Hubei. And those are the pictures that I pulled from the CCTV official social media account, where all these physicians are under the banner of the Chinese Communist Party, right? And it seems that they're organized by the government instead of the fact that they are volunteers, right? And all of this shows that the government is doing something. instead of individuals volunteering for this. And these some other pictures. And so what are the governments doing through WeChat? So from January 22nd onward, we start to see information out there, and we start to see the number every day updating on WeChat. Okay, and these are some of the information. You can see this is the national data, and my field site is in Guangdong province, where SARS originated. So this is Guangdong province with details of every city and every county. And this is a website of the county that I'm working at, also my hometown as well, where it shows you where are the cases in each district or each village. And also I talked to my friends, my parents, and what happened is in the counties, there will be a card circulating around the county with a speaker and telling people to stay at home and how many cases around. And my grand uncle is the village head of my village, and what he does is he organizes a WeChat group and tell everybody what's happening every day and update them with information. And then that one is a blue map. So I worked with this company before. They originally focused on pollutants across China, and they also have this map very fastly pulling up for the people. So if you look into that, you can see there are 346 cities that have infected cases right now, and then you can look into each cities to see how many cases they have. Okay, and this is very easy for people to navigate. And there are more cases, more information in their website if you look into that. This is just, it's also obsolete in some way. I pulled it up in February 17th. Another thing that the government is doing, I know a lot of you probably know the A whistleblowers at the beginning. It's very difficult for me to use this word because in China we don't have this word, whistleblower. So what happened is there are A physicians from hospitals in Wuhan, and they start to tell their colleagues what's happening in their hospital, like there's some SARS-like virus, and then they got arrested by the Wuhan government. So Li Wenliang died of the infection on February 7th, and so then we get a lot of pushback online from the people and ask the government to release the data on the physician who get infected throughout this process and how many died. They want to know the information. And then on February 14th, the National Health Commission through CCTV published the data. 1,716 health professionals get infected with cyst deaths by February 11th. But Ding Xiangyuan has a different data here. So again, they have a lot of physician members throughout the country. So what the number that they get is 3,019 health workers were infected in 422 health institutions, providing health care to infected patients with 5 deaths. So now they start to question the government. Why do so many health physicians get infected, even though they are the people probably who can get a lot of supplies, right, instead of the public? So they start to question the gap, why there's a gap in the distribution of the health supply. And that's one of the things that they are pursuing right now to try to understand where are all the supplies gone. And the government also tried to increase the beds to accommodate the demands for healthcare. For example, you probably have seen this a lot, right? Where they built the Huoshengshan hospital within 10 days with 1,000 beds. But another thing that you probably don't know is they start to appropriate a lot of the college dorms, and they just throw away those belongings of the students without their consent. onto the square and start to make those into quarantine cubicles. So those are some of the problems that I identified through looking through the feeds and the posts on WeChat. But the government, starting from this week, the government said, oh, even though we need to fight the disease, but at the same time, we really need to initiate our economy as well, because that's what's important, right? So they start to publish all this propaganda from this week. It's really accurate because people are going back to work and they want people to feel safe to go back to work. And so it says 1.5 billion people are fighting, every one of you counts. In the middle, published by CCTV. And then those are some of the propaganda about physicians, how they fight very hard, as if they fight very hard for the government, not because they volunteer. And these also show some of the military going to Wuhan, and that is called the physician column, and this is called the military column. And they're going to have, so there's some policies coming out right now, subsidizing the micro companies or like some smaller companies. But they start to have some articles that said, okay, all this money that are supposed to subsidize those small companies actually go to the big companies, like Tencent, right? Like Meituan, some of those big companies probably you know. And so we start to see those tension created in WeChat, and we'll see how it goes later. And that's it. Thank you.
Thanks, Xiaoling. And so we will have questions in a minute, but we will hear from Travis.
Great. Well, thank you, Tim, and thanks to the Center for Asian Studies for sponsoring this and for having me. I wanted to basically cover 3 points, I guess. First is what this crisis looks like from the ground here in Shanghai. Talk a little bit about some of the both local and central state effects, and sort of look at this crisis a little bit in terms of infrastructure and domestic politics in China. And then finally talk a little bit about some of the global effects and things that you might be seeing there in Colorado or in the news in the US. So the sun just came up here a few minutes ago, and we've been here at home for like a month now. The Spring Festival holiday began right at the end of January, essentially on the day that Wuhan was first locked down. I had just gotten back to Shanghai from an international trip, and we canceled plans to travel for the holiday. News was already spreading that Wuhan was being locked down, and so we changed our plans pretty quickly and stayed at home for the normally quiet Spring Festival holiday, which usually lasts about a week. And in some ways, the holiday felt on the street like many holidays do. Lots of people have gone back home to see family. Businesses had closed. Just sort of the bare necessities stayed open, grocery stores, and the like. So that initial first week, actually, let me pause here. Can everybody hear me okay? Is the audio all right?
Yeah, we can hear you great.
Okay, good. So it started off as a normal holiday week, a very quiet one, with news spreading about the coronavirus and about what was happening in Wuhan, and not much knowledge about what was happening in terms of the virus and in terms of what the concern should be. But there was certainly fear, I think a little bit of worry about what the government was doing, and maybe even more so what was not being communicated, what the government was not doing, perhaps. Schools have been closed now for about a month, ever since the holiday, and it looks like schools won't open here for at least another week, and it looks like that might even be pushed further back into March. So by the end of this Many students will be out for well over a month. For those in some international schools, it might be closer to 2 months. So this picture is kind of characteristic of Shanghai during those early days of just being very quiet and not many people out. But again, it started off during the holiday, so it would be quiet, not probably this quiet, but it was just one of these interesting sort of feelings of how much of this is the holiday and how much of this is the crisis. So once the holiday ended, which was about, let's see, it was 10 days or so after the first lockdown, so it was early February, I forget the exact day. Grocery stores, pharmacies, tobacco and liquor stores all remained open, so there was never this crisis of food here or any worries like that. You see pictures of lines, for example, in Wuhan. It never got that serious here. But I think supply chains have been disrupted because you see lots of big gaps in the shelves in the grocery store that takes time to fill, and there were a couple of days when the vegetables disappeared from the bigger grocery store nearby. But a local shop in our compound was selling vegetables out of big boxes that were delivered from within 100 kilometers of Shanghai, so fairly local. It was local produce coming in. The closest mall to us here has been open for a lot of the time, at least partially. Uniqlo has been open, clothing store, a jewelry store, a few cafes. But for the most part, us here personally, and like a lot of people, we've ordered out a lot, we've cooked at home a lot, and just generally stayed at home. Masks have been sold out in pharmacies since the last week in January. They are available online, but also the neighborhood committee, the Juwei Hui, which is kind of the lowest level of the party structure, the one that most people would have sort of day-to-day contact with. You can register for masks. They're supplied through the party office here. You have to register for that. And just some things that have kept life going here in the midst of all this. I think us, like many people, have relied on things like our mobile phones and the internet, and increasingly delivery services, or Kuaidi, which is supported by kind of an army of young men riding around on electric scooters. And of course, during the holiday, there was very, very limited delivery service. Most people were home or taking that holiday off. And after the holiday, those services have resumed now. And now, in my compound, for example, the management office tells me that about 1,000 deliveries come in the gate each day, each one on a fast electric scooter. And one grocery delivery that I ordered, I got a text message saying the delivery's here soon, come pick it up. I picked it up, went home, and a few minutes later I got a text message from the store saying that my delivery guy wore a mask the whole time and he has a normal temperature. So even the delivery service is being sort of integrated, or I should say maybe the public health awareness is being integrated into the normal day-to-day delivery service. So much of life has moved online, from schools to work. I think, Tim, you could skip ahead to number 3.
Thanks.
Yeah.
This one?
Yeah, so this is a social media post. The biggest challenge working at home isn't that collaboration tools aren't easy to use or that remote communication isn't efficient. It's that the kid at home isn't going to kindergarten. So while we get really sensational headlines internationally especially, and while there is a real dire situation, or at least there was, and probably still is on the ground in Wuhan, particularly in the medical system, by far, life for most Chinese is kind of muddling through being at home, staying at home, even as people now are going back to work, even if that doesn't mean going into the office yet. Those offices are starting to open. A friend of mine actually told me that he went back to his office for the first time last week, and he had 5 temperature checks going through the building during that day, and that his shuttle bus to work plays a video on a loop of how to properly put on and take off a mask. So he's watched that video over and over again. And last, just a question that I asked our neighborhood committee about one of the things that you've seen in the news that I've heard about are entry and exit passes that some compounds are implementing that allow, say, one family member to leave the compound every 2 days to go grocery shopping or something like that, to try to control mobility. And they told me they're not doing that. It's used in some places, even in Shanghai, but that it is really up to the compound and the neighborhood committee to decide to implement those kinds of policies. And so the banners that Molly showed a little bit earlier, for example, that's not coming directly from some sort of national directive, or even in some cases probably a provincial directive. There's a lot of ad hoc decisions being made about how to respond to this crisis. So for example, with 1,000 deliveries coming in the compound and with concerns about the infection, the security and management here has decided to sort of centralize and make deliveries all go to like a few tents outside, just inside the gate. And so I think it's arguable how much that prevents any sort of infection, although it does show that they're doing something. And so there's lots of ad hoc decision-making being done to respond, even if it's not maybe objectively or more objectively speaking necessary. There's almost like a performance of response. And I think a lot of the temperature checks, for example, are a similar kind of performance of a response. So jumping ahead to sort of local and state, central state effects, I was thinking about this in 3 ways. One is infrastructure failure has probably contributed to this crisis. Xi Jinping mentioned in a recent speech that China doesn't have enough medical facilities and staff. And if anyone in the audience has ever been to a Chinese hospital on kind of a normal day, it can be overwhelming, the lines and the crowds. So in a crisis, there's just not enough resources, not enough staff. There's been reports of not enough testing kits or protective equipment. There's not even enough hospital beds, even with the construction of new hospitals, people being turned away. I heard a case of public transportation being stopped in Wuhan and people walking to the hospital with symptoms, maybe fever and a cough, and then being turned away and told to come back tomorrow. So there's also cases of towns and villages building roadblocks, even destroying roads to try and block traffic coming in or out. So there's definitely an element of infrastructure failure that contributes to the crisis. There's also maybe a point to be made that infrastructure improvements may have also contributed to the crisis. And that is the next image, Tim. With more extensive transportation networks, more rail lines, high-speed rail, new airports, it's a very different situation here than it was 17 years ago. The New York Times pointed this out in one of the charts that they've published, that in 2003 there were about 1 billion domestic travelers a year, and now there's 4 billion. So we've got 4 times as many people making trips around China, and that's something that the infrastructure improvements may have helped spread this virus further than, say, in SARS. And the infrastructure has also helped push the government to action. Both social networks, as Xiaoling was showing us, internet service has been uninterrupted, throughout this whole period. So it has enabled people to continue some semblance of normal life, whether it's school or work or ordering food. And also running social networks, keeping people informed with, in absence of state media reports, especially in the last week or two. So in a way, the infrastructure is also helping. So those are just some of my thoughts about how this crisis has played out, and in certain cases been worsened or not by some of the infrastructure projects and development over the past 17 years. There's also some comment about what this does in terms of government criticism, and talks about Communist Party legitimacy, and that I think it's really clear that China, we can talk about China as an idea, kind of fumbled things. You know, some of the problem was systematic. Wuhan's mayor, when he first made public statements about the crisis, said that he couldn't declare an epidemic until getting central government approval. And so there's perhaps some element of political structure that prevents some of this information from coming out more quickly. So some of the problem was systemic, but I think that while the central government gets some of the criticism, a lot more of the criticism, I'd be interested to hear Xiaoling's thoughts on this. I think a lot of the criticism has been directed at local government, both Hubei province and Wuhan city. And I think that what we might see, and then we can look at the next image here, is the central government taking credit for the recovery. Already we see some of the topmost leaders in China joining the team to contain the outbreak. For example, Li Keqiang and Wang Huning, who's pictured here, who's kind of China's top ideologue, the most influential political theorist, and kind of the man behind three, both Xi and the previous two top leaders in China, really the intellectual force behind this justifying of a strong central authority to guide modernization. And so seeing him as part of this team is interesting, and showing just how much this is important for the central government now. And I think you're going to see this propaganda, as Xiaoling sort of illustrated some from the CCTV posters, that the central government, I think, is going to swoop in now and sort of claim some of the leadership. Censorship, I think I'll come back to maybe in questions later. The economic effects, I think, are still, it's still early, but I think already we're seeing reports about how much this is going to affect both China and the global economy. One of the things for me that I find most worrying, I guess, is how much this affects small businesses and companies. Lots of people just trying to make a living through whatever small store or small work that they can do in big cities. And I think that this crisis can be decimating, in particular for those groups. The big companies with deep pockets will be fine, but I think this will do a lot to affect those smaller businesses. And then one thing I think it's worth talking about is biosecurity. Within the context of surveillance in general, in China, I mean, cameras have been along for a long time, closed circuit video monitoring. But now that artificial intelligence and machine learning can kind of create real-time video analysis, sort of this always-on surveillance, it sort of takes this security apparatus to kind of to a new level. You also have things like the social credit system, which is aimed at assessing the trustworthiness of citizens, where even things like jaywalking or recycling your trash can impact your score of how trustworthy you are, and by implication, what a good citizen you are. And now extending this into the middle of this crisis, getting your temperature checked, and we can move to the next slide. Getting your temperature read and logged multiple times during the day is just a part of life, at least during the crisis. Xi Jinping made a speech last Friday, or it was reported, at least last Friday, that there's a need for a new biosecurity law that would help address crises like this, but take advantage of big data and artificial intelligence to deal with and manage these kinds of events. But a colleague of mine here mentioned that he had heard of a large grant given or at least offered by the Ministry of Public Security to a company to develop facial recognition that works even for a face covered with masks. If you've been following the news in the New York Times about Clearview, a company that's already doing this and it's already being used by law enforcement in the United States, I think it's along those lines. He had also heard about Wi-Fi enabled door sensors for people who are being quarantined or self-quarantined, that if they open, they send some kind of message to the neighborhood committee to notify someone has opened the door. And so in China, where the surveillance economy has already been rolling, as it is in the US in many ways, here it merges with state security efforts in a way that raises questions about biosecurity into the future. And then finally, just talking about some of the global effects and impacts, things that you may be seeing, reading about, some of you may even be experiencing yourself. One is fear and bias around outbreaks like this. Tim mentioned at the very beginning the rise already in anti-Chinese sentiment. To talk about the virus for a moment, and to come back to the bias question, that I think part of what's happening is there's a lot that's unknown about the virus, and this gets back to some of Molly's comments as well, just how fast information is changing and how much is still needs to be learned. But I think that mystery drives a lot of fear. There's no vaccines or drugs to treat the disease. I think when, for example, the Wuhan mayor announced that, and again, he's been sort of ridiculed for not really knowing the situation or even how many face masks are available locally. But he did say that about 5 million people had left Wuhan before travel restrictions were imposed on the 23rd. So up to 5 million, who knows? I've heard as low as 300,000. I don't know what the numbers are, but this created a real concern nationally about Wuhan residents, Wuhan people and Hubei residents leaving. And there was criticism of Wuhan residents for leaving. So if we go to the next slide, this is another CCTV advertisement responding to some of this growing criticism of Wuhan people. If you look at Chinese license plates, the first character on the left is a symbol for the province, and here the symbol for Hubei is which is an ancient imperial kingdom from 1000 BC. So Eren on the left is a way of talking about Hubei people. But is a homonym for villain, or kind of a vile person. So you have Eren are not Eren, to play on the homonyms of Hubei person and villain. And I'll come back to this in a moment, but there's been some of this bias and fear, even directed internally in China, against Wuhan people. In terms of xenophobia and racism, some of the opening comments mentioned just this context, both in the US, domestic politics driven by Trump, the Muslim ban, and so xenophobia was already amplified going into this crisis. There's a lot of awful stuff out there, racist comments and images about China and Chinese. I sort of feel like a lot of it's troll bait that's not worth really even dealing with, but the fact that the coronavirus doesn't discriminate makes these comments kind of fundamentally dumb. But anti-Chinese attitudes have have been with us, and they've been amplified, particularly since this trade war began over the past year, with the threat, either perceived or real, about Chinese influence and espionage among students and scholars. And then there's also this long legacy of racially based categories and interpretations that persist today. News outlets in the US and in Germany and in France have all referred to things like a made-in-China virus, a yellow peril, and even referring to China as this real sick man of Asia, which goes far back. Even the popular name of the virus, the Wuhan coronavirus, puts undue focus on that local population. But we see a long history of kind of blame for the effects unfairly on the people who were first affected. And I guess just one final, maybe second to last comment, if you can bear with me here, is about fear. And I went back and I reread, if anyone there has read Daniel Kahneman's book, Thinking Fast and Slow. He writes about Cass Sunstein, a legal scholar who writes about these two ideas. One is probability neglect, where it's easy to focus on the number of cases and to ignore the population. So in China, you've got 60,000 cases or so, maybe more, maybe that's Hubei. In any case, the vast majority of the cases are in China. However, it's a country of 1.4 billion people, and the scale of the crisis may not be as dramatically or threatening or concerning as the numbers might show. The second thing is what he calls an availability cascade, which is this self-sustaining chain of events that keeps our attention glued to the crisis, and it creates this emotional reaction that cascades, and it goes on. And the availability of this idea of a new virus and a threat coming from China, it drives the story, and it helps to drive increasing concern and maybe even in some cases obsession with it. So that combination of a mismatched sense of the probability and also this constant reminder of a possible threat, it can distort our picture of reality. And certainly as somebody who's been living in China watching this happen, I've had my moments of like, is it time to buy that plane ticket, or what are we going to do? But I throughout this crisis have kept in mind things like the fact that the annual flu virus in the US alone kills, or at least is a factor in 35,000 deaths, for example. I'd be interested in Molly's take on that flu comparison, maybe in the question and answer. But one last thing, and that is about the power of pathogens. And that is that the virus itself demands responses, and in that way it's powerful. That these tiniest of things, these sort of little bundles of RNA or whatever the definition of a virus is, exerts incredible effects on human life. And we've seen this throughout history with lots of different infectious diseases. I happened last October to teach a class on the cholera epidemic in London in the late summer of 1854. Cholera also caused by a pathogen, in this case a bacteria. The case is very different. I'm not trying to make a comparison with the current crisis in China, but what is similar is how much this tiny thing mobilized a response. In the case of Victorian England, it helped to institutionalize germ theory, a new approach to public health. It helped to professionalize new sciences like statistics and epidemiology. And also, it's really interesting to think about this, how that bacteria forced a new approach to designing cities, of separating sewer systems and drinking water. And many of the sewer lines and tunnels that exist in London today were built back in response to that crisis. And so I mention this simply to point out that pathogens are powerful and they demand responses, and how we respond to them is something we need to think about. Over 40 infectious diseases have been discovered since the 1970s, among which are Ebola and HIV and SARS, and, avian flu. Our antibiotics and antimicrobial drugs are becoming less effective in certain cases. And so with climate change happening, which does influence in certain cases, shifting habitats of things like mosquitoes and bringing threats, maybe raising the possible threats. I think that these kinds of situations and crises are going to keep happening, and it's in part upon us, even as distant observers, but as anyone involved, to think about how we manage these and to get back to sort of the fear and xenophobia side of it. I think it does us well to keep in mind how our perceptions and our fears can be an element in driving some of the emotional responses that can feed the unacceptable racist behavior, that not the extremes even, but some of the day-to-day racism and fear that is encountered on subway systems or on sidewalks or things like that. So let me end here. We can talk about some other things and come back to some of these questions and answers, but those are some of my thoughts about things in Shanghai and domestic politics here and some of the global responses.
Great, thank you, Travis. Okay, I think what would work best in particular so that Travis can hear questions, we'll use a mic. So any comments or questions or anything, I will go find you when we have someone here in back.
To what extent do you think that to what extent do you think that recency? To what extent do you think that recency contributes to the
Just say it loud.
Yeah. To what extent do you think that recency contributes to the hysteria surrounding the disease that is the coronavirus? Do you think that in a few months' time or so that kind of the fear and the racism and the xenophobic remarks regarding it will sort of die down as we become more, I guess, indentured to the fact that this is something that exists?
I can start on that one. So a lot of that depends on how this virus goes. So if this actually does blow up around the world, I think that we will continue to see the fear and the xenophobia that comes with it. But remember, everybody, that there is currently a raging Ebola outbreak going on. Right? Like, do you guys know that? Do you have, an awareness and a fear of African people because there's an Ebola outbreak going on? This is the second huge Ebola outbreak of international concern. It dies down. It really, like, the fear and the xenophobia dies down. Even if the disease is still raging once it falls out of the headlines. So really, it's something that the media fans, the media controls, and the media can do something positive about it too.
Travis, can you hear?
No, I can't. I can hear you a little bit, but not clearly enough to follow.
Okay, we'll try and.
Is there one microphone that's
Your mic sounds great.
Yes, because I'm standing right by the computer. I will try and repeat the question for you. Could you hear Molly's response?
Not enough to follow closely.
No.
Okay. Well, I'll repeat the question up here, and then
Okay.
we'll do the best we can to make sure you hear.
Yeah, sure.
So what I think we'll do is, if you just shout out the question, I'll repeat it up here so that Travis can hear. So yeah.
Has there been a marked difference in the handling of this virus and the, let's say, SARS virus, or I guess the avian flu, sorry. I know that there was a lot of criticism of the central government for the way they handled that particular one way back when, has there been a noticeable improvement, let's say, in the way that they handled this particular one?
So has there been a marked difference in the way this virus has been handled in comparison to SARS and or the avian flu virus?
Correct.
Is that fair enough?
From the medical community, yes, absolutely. There's been a lot of commendation and a lot of praise to China for handling this one much more quickly. There was still some cover-up in the beginning. There is still concern about Dr. Li's death. There is still, we still suspect that the numbers are vastly underreported, but it's better. We learned from SARS, it's better. There's still a long way to go. I don't know if you have thoughts on that too.
Yes, that's like an affirmative answer. It's definitely improved a lot in terms of response. And I can also see because I focus, during those days I focus on WeChat a lot, and that helps, even though there's a lot of censorship in WeChat or other social media, but still it helps to facilitate the information to disseminate among a large population very quickly. So that helps a lot to urge the government to respond as well, compared to the 2003 SARS, where we don't have a lot of information at that time.
Travis, any thoughts on that?
Yeah, I mean, I think it's sort of yes and no. I mean, I think that there's clearly the medical community and scholars in China in many ways do the best work, and maybe sometimes in spite of government officials. I mean, it was interesting, Xiaolings, you pointing out that Wuhan was in the middle of these major political meetings while this crisis was unfolding, while people in the medical community were trying to raise the issue. So while the government's in meetings, you've got the doctors and the frontline medical people dealing with this. So in a way, the yes and no, I think, can somehow split a little bit into the people dealing with the crisis and the public who are mobilizing and communicating on the internet, and at least some part of the government, whether it's local to Wuhan or Hubei, maybe even national sort of central government departments. There definitely was some failure. I mean, in a way that the nation should have been better prepared, given the fact that 17 years ago it went through SARS. The extent of that and how to measure it, I really don't know. But I think that in terms of response time, once it decided to get into action, and the advantages of technology that we have now in mapping the genetics of the virus so quickly, those are absolutely improvements. So it's a qualified yes, I guess.
I guess I should also say that, so Travis raised a couple questions that he was interested in hearing both your feedback on, but I should also just invite you guys to, whether you have questions for each other or for Travis as well, while you guys are also thinking about your comments.
I do want to ask Travis about because you also mentioned the issue of the politics between the local and the central government, and I also kind of feel there's something happening there. I feel through this communication between the central government and the local government, in terms of responding to the public, I can see that the central government is distant itself from the local government in lots of ways. So is that also what you're feeling, or how do you approach that?
Yeah, I mean, there was criticism of Xi Jinping for not appearing earlier. I don't know what the reason was, but one way you might interpret that, particularly with how quickly the central government mobilized after the 20th or so in January, once they sent a very well-known epidemiologist to Wuhan on the 18th, I think, to begin to assess the problem. By the 20th, the central government was sort of beginning its response, and there was certainly a delay in information locally, probably gone to the central government. But once the central government got involved, I think it can position itself as finally taking hold and being a leader of this crisis when the local political, the city or provincial governments sort of drop the ball. And so the narratives, in some ways, I think helps the central government. And the criticism, I think, when we talk about and see these headlines about Chinese criticizing the Chinese government, I think it's really helpful to think about what we mean by the Chinese government. Are we talking about local government, city and provincial? Are we talking about national government, and what differences are there between the two? I think the public opinion, it's worth watching anyway, of how much criticism is directed at the central government and how much is directed at local government in Mumbai.
Other questions? Comments? Yeah, go ahead and shout it out and we'll repeat it.
The media hasn't told us much about what's going on in all the various labs that are working on this problem and trying to find cures or treatments. Where can one get that information?
So where can one get information about what kind of work is being done right now in terms of the labs and trying to figure out treatment and vaccines?
PubMed. JAMA. It's in the peer-reviewed literature, and it's hard to read, and there are some media outlets that are good at taking that information and digesting it and putting it out to the public. I subscribe to something called Global Health Now. It's put out by Tulane University, and every day they have a digest of the best public health, like layperson-friendly public health stories that talk about all the advances in coronavirus. So that's where I'm going to point you.
Maybe not reach out, yeah. Any other questions? I just wanted to also point out some slides that I put up here, and these will be also on the CAS website, linked to this event, but a lot of this information was actually gathered by Travis, and I just put it on some slides. This first slide is the data tracker that Molly showed from Johns Hopkins. But then there's some readings, some articles that are useful in terms of what life on the ground has been like in Wuhan, political repercussions from various perspectives. I'm not going to go through them all, but they're all links that you, so we'll post these slides so that you can follow them. Resources in terms of tracking anti-Chinese sentiment in different guises in different places, and then some sensible perspectives on washing your hands, like Molly has been suggesting. And also Travis put together some ideas about if you want to help, if you're interested in donating, where you can go, how those resources can be best used, and how you can be smart about doing that, about fact-checking your social media feed before you retweet and resend things. There's a lot of sensational misinformation out there, and we're all responsible for making sure that we don't spread that too far and wide. And then, of course, the last one, take care of yourself and loved ones. So I know these are not quite maybe that legible from the back there because I'm not using the full screen. But again, those resources will be posted on the CAS website. Any final questions, comments? Okay, well with that I think we'll wrap it up. Thank you so much for coming, and the CAS website for the links and for more information. Thank you, Travis. Thank you, Molly. Thank you, Xiaoling.